February 4th of this year, we went live with Epic. And when we went live with Epic, we were told that we would have to go live with CareWeb QI. Every other hospital in the, in our system, all the other care management departments, the care continuum departments, all had an electronic care management system. They were on Allscripts or Cerner, We at Chilton were still using a paper and a pencil. So now we're going live with Epic. Everything's gonna be on Epic, and now we have to learn CareWeb QI at the same time. So we had to learn two systems at the same time. And I think the best way to describe it is my department is not a bunch of millennials. My department is very seasoned, and as Linda would like to say, vintage people. So it was a huge challenge, but everybody really rose to it, and we've come out great. Like, administration thought we'd lose people because we have people who are almost ready to retire, and Epic was a big deal, and now to add CareWeb QI on it, but everybody muddled through, learned, and we did really well. But one of the reasons we did really well was because of Mary Jackson from MCG. She set up, prior to our going live, she set up webinars, so she gave us like the learning system of how to go through and do the CareWeb QI. And then we were kind of looking for boots on the ground when we went live with Epic, but that wasn't able to happen. So I think we were live with Epic maybe for a couple of months when Mary actually physically came to the hospital, and she spent 2 days with us, and she shadowed everybody to see how they were doing. And you know how they say everything happens for a reason? I think it was really good that she wasn't available when we went live with Epic, because after a couple of months, we kind of had a little bit of a feel for it, and we knew better like what questions to ask, where did we really need help, because when we first started, we had no clue. We didn't know what we didn't know.
Right, yeah.
So thanks to Mary, it was really a good thing. It turned out to be a better experience than we anticipated.
I am so impressed with the way that the team has embraced this. I have to tell you, our senior leadership was concerned because we are a very seasoned department. Some of the folks have been nurses at Chilton for 40 years and 30 years. And, we just keep throwing new technology at them. And, our keynote this morning was talking about the difference between being a digital immigrant and being a digital native. And we are all digital immigrants. So, our folks have been doing reviews on paper with pens forever. And there's a lot of flexibility with that, you know what I mean? Because the accountability is just within yourself. Now you have a system that's making you accountable, because the way that CareWeb QI and Epic communicate, we have these work queues. And the work queue populates with patients whose reviews are overdue. So whereas you might have been, on paper saying, this is a Medicare patient, I've been really busy today getting this discharge plan put together, so I'm gonna write this review on paper tomorrow. Epic's knocking at your door saying, hello, according to my calculations, that review was needed today. So from that perspective, it makes the digital immigrants a little bit nervous. And it was a lot. It was a lot for them to take in, but they rose to the challenge, and every one of them, in their own way, found a comfort level with how to make it through this. I mean, we have one of our most seasoned ladies who everybody was thinking, she's well within retirement age, and everyone was thinking, this is going to be, the straw,
Right.
She came up with an index card system and became one of the go-to people for the younger team members to call and say, hey, how do you do this in CareWeb QI? And she would go through her index cards and pull out her solution. So and we did this with literally bare bones functionality. They all learned, they've been pretty impressive, because everybody's learned something and shared it with the team. We have like an ongoing thread. So between what they're discovering in Epic and what they're discovering in CareWeb QI, they're much happier now, I gotta tell you, than they were. And I won't even say February 4th. I wanna say January, because it was rough. It was rough hearing that this is what the change was gonna be. It was rough having very, very limited access to what it was gonna look like for them. But once we got over the hump of February, I think it's been smooth sailing. And I can't say enough about Mary Jackson and her willingness to work with us, because we were really coming out of the dark ages, and she was patient, she was kind, she was tolerant, she was flexible. We had a few technology glitches between her system and ours when we were trying the Skyping. And so we created workarounds right then and there that allowed for her to continue to do the webinars and have it be something that was value added to our team. And when she finally came out, which was, again, it was great that we had that gap between go live and Mary's arrival, because it really gave us time to develop what our questions were going to be, what the focus needed to be. And when she hit the ground, she was actually impressed by what our team had managed to do. And so it was really a wonderful 2 days, and what we learned from her was just more of this additional stuff, because then people were more settled, they were calmer, and they understood more about the system, and I think they were ready to hear like the next layer, which is really what she brought.